up his numbers for that big, as he faces that big rebellion in Rajasthan. Now moving to Karnataka, which has recorded its biggest single-day spike with over 4,500 new cases. A majority of them are from Bengaluru alone. The situation in Bengaluru is turning grim. Over 2,100 cases were registered in the last 24 hours alone. The state government claims there is no community transmission in Bengaluru, but COVID cases in the IT city are doubling in less than 10 days. Meanwhile, pressure on the Yediyurappa government is mounting over whether the one-week lockdown in Bengaluru should be extended beyond the 22nd of July. Yediyurappa met owners of private medical college hospitals and directed them to reserve 50% beds for COVID patients. We're joined by Stacey Pereira, who's reporting from Bengaluru. Stacey, are there any other measures in place to boost the bed capacity in Bengaluru? Just a few weeks back, the mission was 10,000 beds to meet the rising number of cases.
Well, what we do have now are over 12,000 beds in COVID care centers. These are to man and help people with mild to asymptomatic patients. So that they've managed, but right now functional are only somewhere around close to 2,000 beds of that 12,000 that we're talking about. So yes, there are physical facilities being put in place, but operational wise, not much, because yes, the government is stretched at this point when it comes to the medical staff that is needed. We saw really abysmal numbers for people coming in for the recruitment drive that the BBMP had put in place to get in more medical staff, nurses or paramedics to help out. But having said that, yes, the numbers only increasing across the state. In fact, Bengaluru having more than 50% of the cases that are coming in now. One of the reasons could be is that we have also started the antigen testing here in Bengaluru city among the clusters that we are seeing huge numbers coming from. So there are about 20,000 tests, that is the RT-PCR tests that are conducted. But yesterday, close to 9,000 more of the antigen tests that are also being done. So yes, there are going to be more numbers because there is more testing that is happening in today's time. But whether the government should then extend this lockdown, that is a big question that everyone's asking now. From the Chief Minister's office, we've heard time and again that there is no question of extending this lockdown because they do want to focus on the economic activities, on getting things back on track, and especially in filling the government's coffers. But at the same time, they also need to ramp up that infrastructure, and which is why yesterday there was this meeting with managements of private medical colleges, and they have asked them to give effective today 50% of the beds to treat mild and severe cases. Now, this would also mean that they will bring in the students who are enrolled in these colleges to also help out, and that's how they're going to try and ramp up the medical infrastructure when it comes to having nurses and paramedics all on board. But having said that, the government really has to figure out now whether they're going to extend this lockdown or not. You're also having a huge number of cases coming from districts like Dakshin Kannada, which is also observing one lockdown. So whether these districts will continue with the lockdown or it's just going to be till 5 a.m. on the 22nd, that is something that the government will come out and clear up by this weekend.
Thank you, Stacey, for that update. Stacey Pereira reporting from Bengaluru, which continues to struggle to flatten the COVID curve. We're getting you some breaking news from the ICMR now. Now, the ICMR